Hello, I'm Dr. Maury Gertz. I'm a professor of medicine at the Mayo Clinic in Rochester, Minnesota, and I'm a member of the multidisciplinary amyloidosis group at Mayo Clinic. A number of questions I want to address. The first is, why do we seek philanthropic funds to push the forward research in amyloidosis? Doesn't the federal government fund most research? The answer to that is that the National Institute of Health is currently funding only 11% of its applications. And because amyloidosis is an orphan disease, we seek funding from patient advocacy organizations and philanthropic groups to help supplement what the shortfall is from federal government funding. Therefore, we can't do everything we want without the support of patient groups. Where does the money go? The first and foremost is for the funding of clinical trials. Clinical trials are diagnostic testing on patient groups where we explore new treatments for the management of amyloidosis. It was through clinical funding trial support that we reported the first 2 patients treated with daratumumab for the treatment of amyloidosis, and in the past has funded explorations on the use of ixazomib, pomalidomide, and lenalidomide, all of which are currently used in the treatment of amyloid. Patient funding has also helped us develop some of the new treatments regarding stem cell transplantation in the management of light chain amyloidosis. After clinical trial funding, our next important resource is for outcomes research. At Mayo Clinic, we've seen over 6,000 patients with light chain amyloidosis. And the outcomes for these patients represent a very rich resource of information. It is using this large database that allowed us to explore the value of cardiac biomarkers in predicting outcomes. It has also allowed us to look at the impact of genetics on outcomes. By having so many patients with light chain amyloidosis, the funding that we receive from patient advocacy groups allows us to explore subsets and look at outcomes based on the type of treatment that they've received, important information about when we need to retreat patients, the importance of the level of light chain suppression at the time we begin treatment and resume treatment. So clinical outcomes research is also funded. The third is our Biobank. When patients are seen at Mayo Clinic, we frequently will obtain biopsy specimens, bone marrow, fat, lip, bowel, and will obtain blood samples. These become valuable biologic resources that we use to correlate what we find in patients with what our large database provides. As a consequence, we are able to correlate what we find in patients' genetics and in their biome with some of the outcomes that we've measured. So your funding goes for clinical trials research, for outcomes research, as well as for maintaining our very large tissue repository and biobank. Thank you very much